Welcome back. Remember what this woman told us before the break?
Been over, I couldn't feel my leg, could not sleep. I just couldn't function. It just doesn't even seem real that I had this less than 2 weeks ago, and I felt this good the day after.
She took advantage of the very latest technology when it comes to back surgery. From the Center for Laser Spine Surgery, please welcome Dr. James Ghadially and another one of his patients, Daryl Hickey. Hi. What this woman was saying, you can times millions of people across the country who are suffering with back pain.
That's right, one of the major healthcare costs in America today.
You have been in this business for quite a long time.
30 years.
Yeah, you have seen how technology has changed that makes such a big difference, and we're going to touch on that in a second. But before then, what she was saying, she couldn't bend over, she couldn't this, she couldn't do any, basically, you're stopped in your tracks. You know exactly what this woman was saying.
Exactly. I couldn't hardly walk. I'd have to eat standing up at the bar at the house. I went and had 5 injections in my back. I went to a doctor that put these pins in you. What do you call it?
Acupuncture?
Yeah, acupuncture. I did that 3 times.
You were desperate.
Yeah. And I did that 3 times and still didn't do nothing.
And doctor, it's one of the #1 reasons for disability across the country.
Absolutely.
All right, he had the injections done, and I guess the injections have helped people, but it's not fixing the problem. So is it kind of just a temporary measure?
They have 2 purposes. One is sometimes they do help to a degree, and it can be permanent, but most of the time it's temporary, but it helps with the diagnosis also.
Okay. What was happening in his back that you could see that was causing all this amount of pain?
Well, in his case, he had a very large disc herniation that was pressing on the nerve, and it really wasn't amenable to something like an injection.
When people hear, and think about in the past, you heard you need back surgery, what was the reaction for a lot of you if you heard that? Yeah. And we used to hear that, oh, if you have the back surgery, there's going to be more surgery and more surgery to clean out scar tissue. There's going to be so many different problems, which brings us to Center for Laser Spine Surgery. As long as laser's been out, I think a lot of us still are confused at exactly what it is, but this is really a godsend for people like him.
Right. I mean, this is minimally invasive. Laser is one of the tools we use to ablate tissue, but we also use traditional instruments that are the same size as when it's done open. So we don't do a second-rate job here. We do the same procedure, but with a tiny incision the size of a grain of rice.
All right. So in the past, you were literally cutting in.
In the past, we would come in from the back, remove the bone, cut through all the muscles, move the nerves across to get to the disc in the front. Now we're coming in from the side here using an endoscope, just like in the knee, and we don't take any of the bone away. We just come straight down to the disc, right where it's touching the nerve, and remove that portion of the disc.
So it's like pinpointing exactly what you need to deal with.
You have to get it exactly right.
Okay, and so the advantages are between what you used to do and doing laser are what?
Big advantage is, #1, the surgery should be identical to an open procedure. The downtime's lower, the scar tissue is minimal to none, and it's not destructive.
Yeah, and there's less risk of infection and things like that.
Less risk of infection and a much faster recovery.
Okay, why had you put off doing back surgery?
Well, I just didn't want to be cut on, to tell you the truth, and had my son-in-law, Kyle Ritchie, he introduced me to Dr. Ghadially. And so I got talking to him, and he wanted an MRI to see if I was a candidate, and I was a candidate. And so I come to Houston to get this procedure done.
Yeah, and after all you've been through, fingers crossed that things would go well.
Oh,
and
yeah.
What happened?
Well, from Poteet, my wife drove me over here. I was on my back all the way in the Suburban. I couldn't even set up, so I got to Houston on my back. I got to the surgical office on my back, and after I got in there, I couldn't sit down in the office, so they had to put me in the examining room on a table until Dr. Ghadially got there. Right. I couldn't sit up. I couldn't hardly move. And then I got into the operating room. I finally got in there on the table. I told Dr. Ghadially, I said, hey, just do what you have to do. If you even have to use a chainsaw, just get it fixed right, you know. So I wanted to get it fixed, you know. So he said, he just smiled and said, well, I'll do my best. So anyway, 2 hours later, I was in recovery. And he come in there and asked me if I was okay, and I said, that's fine. And a little bit later, the nurse said, well, you can get your clothes on and go home.
Put your clothes on and go? Yeah, because in years past, it would be like, you'll be here for a few days. But
this was about 3.5 hours later after the surgery. You know, it said, go home.
And ever since then?
And I've been dancing and climbing deer blinds and everything. So he's
No, he said, yeah,
This
you're his
guy's the
miracle
man
worker.
right here. Yeah, this guy's a miracle worker.
Okay, he said you had to check to see if he was a candidate. What makes someone a candidate for this particular surgery?
Well, not every pathology is amenable to an incision that's 7 millimeters in size. So if you have localized pathology that can be identified accurately, then this is for you. But there are cases of multiple levels and bony stenosis that need open surgery. For example, central canal stenosis can't be addressed by this, but foraminal stenosis, where the nerve comes out, can. And it's a matter of being sure that we're offering the correct operation for the correct pathology. The other great thing about this is these patients are done with this procedure awake. So they're sedated, comfortable, they're actually awake and responsive, and he told me, for example, as they all do, as that lady told me, on the operating room table, my leg pain's gone.
Yeah.
So I know immediately that I have fixed the problem. That's something we never could do with a patient.
And doing that awake also reduces some other risk with anesthesia.
All those other risks are gone. I've done some very sick people who can tolerate sedation but can't tolerate a general anesthetic.
Well, congratulations to you, up and dancing again. I can't believe you caught the cat laying on your back.
I wouldn't be here today.
Yeah, it's amazing. And then again, a lot of people who have a thought of back surgeries from the past, great education here that it doesn't have to be that. All right, last question, because I know it's circulating in people's heads because we live in such an international city. Where's the accent from?
Oh, I'm originally from far East Texas.
Yes, okay.
known as England.
Okay, there you go. Well, thank you very much. I know there are a lot of people out there who are suffering with back pain. This could be the answer for them. Dr. Ghadially has a special offer. If you call his office and mention Great Day Houston, you can get a free MRI review. That can help determine if you are a candidate for laser spine surgery. Call the office today at 713-528-3901. 713-528-3901. You can also find them online at HoustonLaserSpineCenter.com, HoustonLaserSpineCenter.com. Thanks again.
Thank you.